I will comment about the world of work and men, because one of the part of the core identities for many men, is they believe for them to be successful in achieving, they should be productive, and that means the world of work. Unfortunately, maybe they wouldn't consider like being a stay-at-home father or being, a coordinator of a kids center. That would be, in my mind, productive. But when they're younger, they don't think that. So in the economy, when the labor market shrinks and there's less of an opportunity for them to express themselves in the world of work, one of the threats to them is shame. Because one of the major areas of self-identity is being productive and working, and if you can't work, feelings of worthlessness that tracks right into is a predictor of depression. So it is a risk, absolutely. And I would like to think we could change males or expand their roles of productivity, which include non-traditional ways. But for many of them, they are quite fixed on what they imagine to be successful, and if they're not available, I think that is a risk, especially. And alcohol, drugs increase because of the role restriction, the lack of opportunities. They get feelings of worthlessness. I said before, they medicate, and then that leads to depression and isolation, and then we've got a problem. So I think it's very, very important to address this in the world of work.
If a guy likes his work, he's going to be much, the prognosis initially is going to be much better. The other thing is if you can identify where the blocks are at work and why is it that he's no longer enjoying it. For example, sometimes interpersonally there'll be something that happens where a colleague or coworker may be either slightly bullying them, or they've had a disagreement, and it's like two brothers who don't talk for 10 years. You've got to walk this thin line of ice where you're around this person every day, but because you're of your pride and your communication skill level, you may not want to intervene, or you may not want to connect with this person because you feel like you didn't do anything wrong, but inside it's just eating you up.
One of the complexities of people working in healthcare, for many, it's a job, it's work, and it's a sense of vocation. So they've come there for something bigger than themselves initially. And eventually something comes up, or they have a depressive episode, which then their whole being comes into question, and they function in isolation. And more and more, the work in healthcare has to do with the need to work together, collaboratively with other physicians, with other healthcare providers. So that if I am one of those men and I withdraw because it's something just doesn't feel right within me, it's not the same, then it affects my performance. So then it can also alter my relationships with other people, and they begin to wonder about what's going on. So it's a real bind with regard to my sense of professionalism. And in our work, we talk about presenteeism and absenteeism. Absenteeism means I'm not at work. Presenteeism means I'm at work, but I'm not fully there, or I'm not really there. So the work I do is with people who are experiencing presenteeism, where they are at work, but it's just not the same anymore, David. It doesn't mean the same to me. There must be something wrong with me. And then it can actually affect their performance and their performance appraisals. So it can be a very downward spiral with regard to their experience at work, which then just exaggerates and exacerbates the depression.